Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast.
All right. Hello, Dr. Gray. How does it feel to be a mom of two boys now?
I'm doing great. Loving it every day.
Well, I remember it being a tiring time, but it seems like you're handling it really well with your friend over here.
I know. We have a little one joining us today in our studio. My sweet little baby of 6 weeks old has decided that he wanted to be a part of all the action today.
Awesome. Well, hello to all of our listeners as well. Welcome to our 10th episode. And as we mentioned, we are here with Dr. and Baby Gray, as well as myself. Thank you all for listening and to all of our supporters.
The reason that we do this is for you guys, all of our listeners and supporters. So thank you.
And we also want to thank you for all your feedback and ideas. We love hearing what topics you guys want to hear next. And today on the show, we are talking about more gut health.
Backed by popular demand, of course.
We are talking about irritable bowel syndrome, or more commonly known as IBS, just in time for IBS awareness, which completed in April. So by the time this comes out, we'll have finished about 2 days beforehand. But still, irritable bowel syndrome is a topic I discuss a lot as a gastroenterologist, especially because it can be so frustrating for patients. There is also so much misinformation on social media and online about IBS.
It is a difficult disease to manage, but once I think we can shine some light on. We will talk about dietary management, a very important part of IBS management, especially the low FODMAP diet recommended by many GI doctors. I mean, what the heck are FODMAPs anyways?
That is a pretty great question. First of all, we're going to talk about what IBS is, who has it, how we manage it. And then in the second half of today's episode, we will go into more detail about the low FODMAP diet, a term used a lot and not well understood by many. So let's break down fact from fiction and answer our listeners' questions about IBS.
Okay, Cari, let's start with the basics. What is IBS?
So IBS is a derangement in the brain-gut connection, or axis as we call it, and coupled with psychological factors such as stress and anxiety that lead to abnormalities in how your body processes pain and abnormalities in your bowel movements.
Of course, you can hear my little one making all sorts of fun little noises. He goes through all of those same complicated processes as well. But so Cari, what do we know that causes IBS?
Well, it's kind of a complicated question to answer. We don't know exactly, but it's classified as a neurogastrointestinal disorder because part of the problem is, again, that brain-gut connection I just mentioned that leads to a hypersensitivity of your nerves in the GI tract to pain and an abnormal response to stimulus your brain sends to your bowels to have a bowel movement. We also think gut bacteria can play a role. We see, right after someone gets an infection or like a viral gastroenteritis, sometimes they can have a transient IBS type symptoms and without ever having similar symptoms before. There's also sensitivities to certain foods and stress, especially stress at a young age, such as physical, sexual, or emotional, which contributes to symptoms.
Wow, that is complicated. No wonder it's so difficult to manage. What kind of symptoms do people with IBS actually present with?
And that's what makes it so tough because since the brain processing part of it and the psychological factors that play a role vary person to person, each person experiences their symptoms a little differently. Also, it depends on the type, but the most common symptoms are going to be abdominal pain, bloating or cramping related to a bowel movement, and changes in the consistency and or frequency of bowel movements. Some other symptoms include feeling like you've not completely evacuated your bowels, or sometimes you can even get some increased mucus in your stool.
So when should someone be concerned that their symptoms are not caused by IBS? We talked about before about like cancer and other really concerning findings, or inflammatory bowel syndrome like Crohn's disease or ulcerative colitis.
Yeah, you kind of have to look at all the symptoms and the age groups that you're looking at. So for example, ask questions like, is there associated blood in the stool? Is the patient less than 40? Are there clear triggers such as food and stress to symptoms? Are there concerning symptoms like frequent blood in the stool, an older patient, and no obvious triggers? Then the chances for cancer are more likely, or inflammatory bowel disease. If you don't have any of those alarm symptoms, if the patient is younger and there are clear food or stress triggers, then symptoms tend to be more likely related to irritable bowel syndrome.
You mentioned different types of IBS. Can you tell me more what the different types actually are broken down?
Right. So there's diarrhea predominant, which means you have all those symptoms I mentioned before, but your main derangement in your bowels is diarrhea. That's the most common. Constipation predominant, where you have all those other symptoms, but your bowel movement is harder. So constipation. And then there's a mixed type where you alternate between the two. We'll talk about these types more when we talk about treatments.
Perfect. Then answer me this. Who presents with IBS?
Well, 10 to 15% of the US population is going to have IBS. So it's fairly common. Usually it's seen more commonly in women than men. It's twice as common actually in women than men. And usually you do see it in younger people with symptoms starting after age 50 being pretty rare.
That's a large percentage, though. No wonder it's a hot topic on things like social media. On TikTok, they're always talking about what's the best gut health diet or how to handle IBS. And you see a lot of influencers or other people trying to say, go ahead and buy this product. It'll solve all your gut health issues, right?
Mhm.
So, how do you even diagnose it? How do you say that that is what it is? Or, you don't want to listen to the social media influencer that says, oh, this is what you've got based on my non professional opinion.
Yeah, and it can be it's one of those things that's easy and tough to diagnose. And I mean easy because if you when we go over the actual diagnostic criteria, that could apply to a lot of people. But it's also tough because it's really a diagnosis of exclusion. And that means there's no one specific laboratory test or imaging test that can diagnose IBS. So usually you have to start with a thorough history and physical, right? Looking a lot at the trend of symptoms, the ruling out the possibility of other diseases, asking questions like, do you have pain related to your bowel movements? Do you notice a change in your poop, and how it looks? How often do you have these symptoms? When did the symptoms start? What medicines do you take? Are there recent life stressors that could be triggering your symptoms? And these kind of questions really help us separate IBS from other diseases. Technically, the diagnostic criteria is based on history alone and includes at least 3 months of symptoms with onset at least 6 months previously of recurrent abdominal pain or discomfort with two or more of the following. So you can either have improvement of the symptoms when you have a bowel movement or defecate, and or associated with a change in the frequency or the appearance of your stool.
Okay, that makes sense. You mentioned treatments. What's the mainstay of IBS treatments? How do we get some people feeling better?
Well, so we'll talk about that in just a minute. So one thing I did want to mention about when you rule things out. So of the IBS, we talked about it being exclusion being important. There are a few tests that I usually always will test on these patients to exclude diseases before we start treatment. And two of those that are really important are celiac disease and thyroid disease, because both of them can present with similar symptoms, but obviously are treated very differently. If you have thyroid disease, you want to treat that. If you have celiac disease, which is a intolerance to gluten, for example, due to actual antibodies that your body makes that cause you to have diarrhea and pain, then you obviously want to exclude that specifically without doing other IBS treatments. And sometimes, since it is a diagnosis of exclusion, your gastroenterologist may want you to do a colonoscopy beforehand to, like you said, exclude inflammatory bowel disease. If it's not clear, they may want to check your stool for infection. Again, because if you have acute onset of diarrhea, and some of these diarrhea diseases can last for months. Like I've diagnosed C. difficile, for example, in a patient 6 months after the diarrhea started. So it's not like you would expect that it's within the first few weeks. It's not necessarily. They may also do something called a breath test, which looks for small intestinal bacterial overgrowth, which basically means that you've got too much of the bad bacteria in your gut, and that bad bacteria produces like gas, and for example, which can cause more bloating, more urgency, and that also needs to be treated with very specific regimen.
So, on
So
that note, I
yeah,
would also say that a great place to start would be with like maybe your primary care physician, right?
absolutely.
And have them run some of those initial tests, talk about it. I mean, they can do things like look for C. difficile infection. I had a family member who waited 3+ months to get in
Yeah,
to see GI, and they
sure.
had C. diff the whole time. They could have been treated easily,
100%.
and just thinking they had some kind of IBS variant or something going on.
Yeah,
So,
absolutely. And that's the great thing. Like I mentioned, things like celiac disease, thyroid disease, infections are all things your primary care physician can rule out 100%
perfect.
with easy stool and blood testing. So those can be even done before you see a specialist if you're concerned about IBS. Obviously colonoscopy or an upper endoscopy, if you need to have biopsies taken, that's going to be a specialist that does that part of it. But there is a lot that can be excluded, like you said, in one of those visits with your primary care doctor. And you mentioned treatments. Okay. So I think it's important to state that there is no cure for IBS. Okay. So if anybody tries to tell you that they have a cure for it, we do not know of one currently. What we focus on really is symptom management. So, for example, when we talked about those types, diarrhea versus constipation predominant versus mixed, you're really going to focus in on which type that person has, and you're going to target those symptoms. So if it's diarrhea predominant, for example, you might treat with an antidiarrheal type medication or a medication that the side effect of it is to stop diarrhea. If it's constipation, your doctor may tell you if fiber needs to change in the diet, which actually can work for both constipation and diarrhea. So we'll talk about that a little bit. And there's also prescription medications for constipation as well. Now, if you have mixed type, unfortunately, since you go back and forth, you might be changing what you're doing from a medication standpoint, depending on if you're having more diarrhea or constipation. There's not a great medicine that's going to control both symptoms at the same time. I will say fiber is one of those things that can work for both. So I use that a lot in mixed type, but there's not necessarily a prescription that does that.
When you say fiber, are we talking about just dietary fiber or also like the fiber gummy pills you can buy or Metamucil?
Yeah, so it's a great question. I mean, really, you kind of want a mix of both insoluble and soluble fiber in your diet. And so, things that you're getting like with fruits and vegetables plus supplemental fiber really help you balance that out. That's the tricky thing about fiber is if you get too much of one, you can have side effects with it. That's the thing about it. And a lot of people will say when they've tried it before and it hasn't worked, a lot of time it's because that balance was off. So I always try to tell people that if you're going to do, and we're going to talk about this in the second half in a lot more detail, but if you're going to do fiber, then, do a lot of different types, not just one, for sure. But definitely a great question. Now, some of the medicines that we use, if you're looking for a prescription, are things like dicyclamine or hyoscyamine for cramping, lubiprostone, lanactotide. I even struggle with these. And plecanatide. Sorry, I just butchered it for constipation predominant. Rifaximin. There's even some of the ones that went off the market and have come back as well. Not loperamide, but alisotron and loperamide for diarrhea predominant. One of the other prescription choices that we have is actually antidepressants can be used for IBS. And usually it's in lower doses and you'd actually use it to treat for depression. So it's usually not at the higher doses that you need to get those side effects. But tricyclic antidepressants like amitriptyline, for example, can cause constipation. So that might be a great choice for somebody who's got diarrhea. SSRIs like sertraline and paroxetine, for example, they can actually cause diarrhea as a side effect. So they may be a great choice for somebody who's got constipation predominant.
Those are great. Those are definitely actually great ones that I can use in my practice too with my patients who maybe suffering from both. We can use it at the lower level for the IBS effect, but maybe even if we need to get a little more anxiety component controlled, I mean, we use, sertraline or citalopram all the time for anxiety.
Absolutely. And there is so much overlap with IBS symptoms and depression and anxiety. So it's really important to acknowledge that and treat all of it as needed. I really try to emphasize with my patients that, just because we know that this is related to a brain gut problem does not mean that it's all in your head or that you're crazy by any means. I know some people feel like with their encounters with healthcare providers, they come away feeling that way, and it's really not the case. And so when we're prescribing these medications, I'm not saying, oh, this is just your depression, this is just your anxiety, and trying to put a Band-Aid on it. But we do know that those imbalances that can cause depression and anxiety can also be related to IBS symptoms. So we're treating that basically.
That's a really good point, for sure. Really, really good point. We're going to talk about diet changes in the second half of the episode, as I know avoiding food triggers is a very important part of the IBS actual management. But what about other non-prescription therapy management? Because I do hear a lot about that on social media, them saying, here, avoid medications. You don't want to use medications. Stop seeing your doctor because they're going to force feed you medications. Okay, fine. If we need medications, you need it. But what other options do we have that are not prescription?
Yeah, that's a great question. There's a lot of evidence, even for probiotics, which can be beneficial for abdominal pain, bloating, flatulent symptoms. Although I will say overall, unfortunately, the quality of evidence we have is not on the high side compared to what we like to see as doctors. And honestly, just because it hasn't been looked at as much, not necessarily that it doesn't work, but you have to have people researching it. And so if people aren't, then it's difficult to get data, I would say. Anecdotally, I have seen it work well for some people and some people not. And I know now they've made it super complicated with recommending, prebiotics and probiotics and, all these things. It's like, do you want to replace the gut bacteria? Do you want to feed the good gut bacteria? And it's, unfortunately, I can say that the evidence is just not as robust as we would like to answer that question. And that's why a lot of the GI societies have really only recommended it in very specific situations, like if you're going to be on antibiotics, things like that we know if you've got histories with C. diff. There's some specific scenarios with that, but I think overall it's one of those things where it's probably a low risk to try it,
Right.
and so you might as well to see if there's a benefit. Again, if it's not going to make you broke doing it and it's not going to be harmful, then why not try it? Now, I know the question I always get asked is which one. Great question. And it depends too on what I'm treating as well. That's what makes it tough. But for IBS, for example, I usually look for one that has Bifidobacterium and Lactobacillus at higher concentrations. And unfortunately, there's such a range. It's hard to say that there's one specific brand that I would say. Again, if it has those two components for IBS, I feel like usually that's what I would look for over the counter. Again, just because the evidence isn't as strong.
And so you're saying that you don't have to necessarily be buying the one that's at the health food store refrigerated section that you pay $40+ a bottle for. We're also saying that you could use something like, name brands, Align, Culturelle, things
Sure.
like that. You're looking for that number, that 1 billion colony forming units. And
Yeah,
that's usually
absolutely.
what I say as well.
Yeah. And I think the ones like the refrigerated, like you're talking about, I use those for patients, for example, inflammatory bowel disease, pouchitis, things like that. And those patients, I will kind of push more towards that because, again, the evidence is a little bit stronger. But I think for irritable bowel syndrome, absolutely, you're right. Those 1 billion CFU with the components that we mentioned, is usually going to be effective enough. Now, people always ask about your diet as well. You can get probiotics in your diet, with foods like sauerkraut, pickles, kimchi, for example, which is actually readily available now, pickled vegetables in general, like beets, carrots, radishes, organic apples, miso, olives, all those things actually have that in there. But it gets tricky, right? Because a lot of those foods are also going to be the list we look at later when we talk about FODMAPs that you're trying to avoid. So again, it's a tough balance. One of the other things that we have some evidence for is triple coated peppermint oil, which does have some backing for reduction in total IBS symptoms. So that's actually one that I recommend in patients. And of course, super important, and I always try to stress this, just as important as being on medication with IBS is stress and anxiety reduction techniques are very important. It's tough because if you already struggle with these issues and you have anxiety and stress at baseline, and then you have IBS symptoms that stress you out, it's just kind of this vicious cycle that you get on. And these can include things like meditation and yoga, exercise, acupuncture, massage therapy, any of those things that help you reduce stress and anxiety will help your IBS symptoms. And cognitive behavioral therapy is also very helpful. So we have some good evidence for that too. And it really kind of helps give insight into some of these non-food triggers that can be difficult for people to identify themselves.
I love that. I really love the idea of adding in some kind of exercise component or something. I know that with my patients, especially with the IBS constipation type, adding an exercise really does help. Moving
Absolutely.
the bowels. It's like my little baby that's joining us. When we do the bicycling of the legs, we can
Right.
help with the gut. So things like that we can use as an adult.
Absolutely. And again, just with, as you do with babies and everyone else is, fluid intake is important. Again, if you're constipation, whether it's IBS or not, we talk about this a lot, is you got to be staying well hydrated.
What is the future of IBS research?
So, that's a really great question. And I'm hope that it's a lot personally, because it is such a big issue. They are looking at trying to identify biomarkers in the blood, which to allow us to subgroup a little bit better with IBS. Because again, sometimes people fall in categories really well and sometimes they don't. So if we had some sort of biomarker that we could test, like for celiac disease in the blood, I think that would be really helpful. Of course, we're always looking at genetic studies to see if there's specific genes that are playing a role in IBS or who is more susceptible to it. There's some food supplements that are actually undergoing clinical trials as soon as a possible treatment as well, again, because there's so much food trigger involvement. And then, of course, there's always ongoing trials for new medications. But they tend to be variations of what we have currently. So I wouldn't necessarily say that I've seen anything that's drastically different, but they're coming out with stuff all the time. So maybe so.
That's awesome. So we mentioned dietary management of symptoms. What kind of diet are you talking about? Let's go back to that specifically.
Right. So the main diet your doctor is probably going to talk to you about is something called the FODMAP diet, and trying to do a low FODMAP diet. So what are FODMAPs? So this is going to sound long. Fermentable oligomonosaccharides and polyols. They're chemical compounds found in food. All right. So that's fancy talk for carbohydrates that are poorly absorbed in your small bowel. As a result, these carbohydrates travel to your large intestine, mostly intact, where our gut bacteria, ferment them. And that process is going to release hydrogen, carbon dioxide, methane gases. And those are what cause a lot of the symptoms that people don't tolerate. The cramping, the pain, the feeling like they have to run to the bathroom. In general, we'll include a link in the show notes of what some of these are, because the list can be extensive. But the main categories we look at are fruits, with fructose exceeding their glucose concentration. So that's going to be like apples, pears, watermelon, for example. The second group is what we call fructan containing vegetables, and that's going to be like onions, leeks, asparagus, artichokes. The third group is wheat-based, so breads, pasta, cereal, cakes, biscuits, for example. And then lastly, sorbitol or lactose-containing foods, such as apples, pears, blackberries, even eggplant, broccoli. And of course, with lactose, you're looking at things like cow's milk, goat milk, yogurts, and ice cream, for example. And those are all just things that are poorly absorbed and thus cause more symptoms.
So I know that I sometimes have patients who think that they have celiac disease and they don't. They've never had the testing, the biomarkers aren't there, but they do cut out things like some of the wheat-based products and they see improvement. And so a lot of times it looks like that's more of an IBS component, and maybe that's the trigger from that FODMAP, situation that we're looking at. That's why it's getting better. It's not because they have a gluten allergy or intolerance. It actually has more to do with the FODMAP diet.
Yeah, and definitely you cannot have celiac disease, which again is antibodies that your body has created and misattacks your body basically. You can have gluten intolerance and overlap symptoms with IBS for sure. It's just that your specific trigger is only gluten, and I think a lot of that has to do with. This is like probably way more detailed than anybody wants, but if you look at historically, like our grains have changed over time. So what we grow currently to what they call like ancient grains, for example. And I think in general, sometimes our body doesn't make that change as well. And so we have difficulty breaking down some of these things. And so I think that's why it's tended to be, I'm going to say, obviously awareness of it, and this probably leads to a lot of why it's diagnosed now. But I think there has been somewhat of a change in our food for the reason that people get more gluten intolerance than they used to.
Okay, that's really interesting.
It is.
I liked that you drifted for that.
Yeah,
so thank you for adding that.
There's like whole books about it, so like that's a rabbit hole if you want to go down for sure. About basically how the type of foods that we're growing and everything has changed, and it takes a long time for evolution to occur for our body to adjust to breaking those foods down.
No, that makes sense. And how do you tell people to eliminate these foods all at once, forever?
Yeah, so definitely not forever. I usually tell people to start off with eliminating as much of the list as they can. And usually, this is why, as you can see with this list being so extensive, why food journaling is so important with IBS. Because what I have people do is then add one food back in at a time and evaluate and document if their symptoms change. So if you add in, a certain fruit or vegetable and you notice that you get an increase in your IBS symptoms with adding that food back in, then take it back out and try something else. So eventually you'll kind of get to your own low FODMAP diet.
Sorry, little buddy. So besides avoiding these foods, what other diet changes do you recommend for people with IBS?
Right. And kind of what we mentioned before, fiber is another one, as far as they can be helpful in like we kind of preface, I like a mix of fibers, and this includes supplemental fiber, like things that you mentioned, like methylcellulose, which is Citracel. We've talked about some of the other ones that people use, Metamucil, for example.
Right.
I usually start with kind of a low dose on these supplements, maybe a tablespoon a day, and titrate it up really slowly. Again, it takes time for your body to adjust to these things. So again, when people tell me they've failed it before, a lot of times it's because they went too much too fast.
Okay.
Or not enough. And so you really kind of want to start with the amount, maybe you not even change it for a week before you go up on it, and let your body adjust to that higher fiber concentration.
Would you say like a month? Give it a
A week,
trial.
a week,
A week on
yeah.
that same one.
Yep.
Okay.
Yeah, I usually do a week and then make the other increase. So
Okay.
I think you can kind of do a week at a time.
Okay.
And I also really like though when people add dietary fiber, like plants that are a mix of soluble and insoluble fiber, like I mentioned. And you kind of have to play around with these amounts because, like, again, too much can also cause more digestive stress. And like we said before, a lot of these are on the FODMAP list. So you really have to pay attention to that. Some of the soluble fibers include things like oats, peas, beans in general, apples, some of the citrus fruits, carrots is another really great one. And then, of course, psyllium. Some examples of insoluble fiber include whole wheat flour, which I know can be tricky for some people, wheat bran, nuts, beans, cauliflower is a great one too. Again, if you can tolerate it, green beans and potatoes. And usually you want to try to shoot in general for about 25 to 30 grams of fiber a day. And before you say to me, but I get plenty, I don't need any more, less than half of the US gets the recommended amount of daily fiber. So it's very likely that you are not.
That is so good to know. Okay, so let's recap that: 25 to 30 grams per day total.
Yes.
And less than half of the United States population actually gets that, even though everybody thinks that
Yeah.
they are getting that daily.
Absolutely. Everyone I have come to clinic and I ask that and they're like, I get plenty of fiber. And then when you actually look at it, which again, why food diaries are so important if you are suffering with digestive symptoms, because I mean, as your doctor, both of us, like, I don't walk around with my patients all day.
Right.
I don't know what you eat during the day. You have to write it down and look at it, yourself as well as with your doctor to see what trends you're noticing. And that's really difficult to do. I mean, I can't remember what I ate for breakfast yesterday.
Right.
By the time I go see my doctor a month from now and I'm like, oh, well, this, I ate this one specific thing on this one day and I don't remember what it was. There's no way you're going to remember that. So you have to write it down to look for trends. But yes, 25 to 30 grams, which most people aren't doing, and a mix of fibers. Again, if you can do supplemental, try to get some in your diet. You're going to have to monitor for some of those side effect symptoms that, could be triggering your IBS to make sure you're on a good fiber.
And so when we say food diary, we're also going to be talking about using apps and things, right? I think a lot of my patients, when I suggest that, they think I need a pen and a paper and a notepad. And that's fine if they were to do such a thing. But there's a lot of apps that help you track it, whether it's for weight loss purposes, or I tell them sometimes use the MyFitnessPal app. There's a free version, and just use it and record everything. You don't have to actively be trying to lose weight or anything like that. But
Absolutely.
just record it so that way you can bring it in on your phone to your doctor and show them, and they can scroll through and say, on a typical day, this is what it looks like. And it breaks it down even into percentages.
Absolutely. Yeah, for sure. And again, it's difficult because your doctor's not going to be with you 24/7. So there has to be something to look at those trends. And the problem, especially with IBS, is a lot of times you won't get symptoms till after you already ate something, which by that time you may have forgot what it was.
Right. So it sounds like a full-time job, just trying to figure out what foods to eat. Is there anything else other than fiber and a low FODMAP diet that you would recommend?
Sure. We talked about why we don't like them in our obesity episode already, but I, of course, advise people to avoid processed or ultra processed foods because high fructose corn syrup is also a main ingredient in processed foods, commercially prepared, sweets, snacks, soft drinks, for example, and these can aggravate IBS symptoms.
And for the soft drinks, it also includes things like diet soft drinks as well, right? I know some of my patients say, oh, well, I don't do regular soda, which is great for avoiding issues like diabetes, things with high sugar content, but also that soft drinks and being ultra processed still can affect your gut health and function.
Yeah. And not even just the ultra processed part of it, but that's why that list includes, things like sorbitol or, sweet alternatives, because a lot of those things can have GI distress as a side effect and be an IBS trigger. So, sugar-free gums, sugar-free anything that's using a different type of sugar supplement can be an issue for some people, so they think they might be doing the best thing for their health by doing like a diet soda, like you mentioned, but it can absolutely make your symptoms worse if you're not tolerating that. I mean, if you eat enough of those sugar-free, I don't know if everyone else has ever binge eat sugar-free cookies, but you're going to get some diarrhea with it. I mean, it's naturally going to pass through your system, You're not going to absorb it well, and you're going to get symptoms. So definitely one you want to be aware of.
Okay. So I think that's a good takeaway. Fake sugars, diet sodas, things like that can actually exacerbate gut symptoms that we may not be thinking about in our diet.
Oh, absolutely. Again, even on sugar-free, that's why moderation is so important. You don't want to overdo that either. Just because it says that it's sugar-free does not necessarily mean it's good for you. And the Mediterranean diet is another one that can be very helpful. It's rich in things like omega-3 fatty acids, for example, brown rice, and then fruits and veggies that are not eliminated on your personal low-fat FODMAP diet. Those also seem to help with bowel movement consistency and appearance.
Well, thank you so much, Cari. That's so helpful coming from a, board certified gastroenterologist who talks to patients all day, every day about this. It's so helpful. That was a lot of funky FODMAP info and a lot of, we'd like to say, food for poop instead of food for thought. That is all for today's episode. Thank you guys for listening. Thank you for letting my sweet little 6-week-old join us on my maternity leave. And he is our number one fan. Please like, subscribe, and share this episode. Let us know what other topics you are interested in through our Instagram, and stay tuned for our next episode.